All right, Delano, thank you. Now on Bounce, January is Glaucoma Awareness Month, and glaucoma is known as the silent thief of sight because it can quietly cause harm before any symptoms ever occur. I want to welcome Dr. Ben Stager from the My Eye Doctor Network. He is here tonight to teach us more about the condition. Appreciate you being here.
Absolutely. Thank you for having me.
Absolutely. Let's dive right in. What is glaucoma?
Well, glaucoma is actually a group of risk factors that lead to nerve damage in your eye that can slowly chew away at your peripheral vision.
Let's talk about the different types.
There's actually a lot of different types.
Oh, okay.
The two most common are primary open-angle glaucoma. The other one's normal-tensive glaucoma.
Okay. In layman's terms, the difference.
High pressures, normal pressures.
Okay, there we go. Let's talk about the three risk factors, because you say that glaucoma is a group of risk factors. I'm guessing there are like three that are kind of the top biggies.
So the number one risk factor is actually age. Everybody has a higher likelihood of developing glaucoma as we age. The number two risk factor would actually be race. People of African, Hispanic, and Asian descent have a higher risk factor of that. And then family history is actually the number three. And so definitely check with your family to see if anybody else, like your grandparents, have developed that, especially later in life.
Okay, and I definitely know it runs in my family history, so I get my eyes checked, you know, every year. They look at the pressure, all of that, to make sure that it isn't getting high. What is the best way to ensure early detection?
Early detection is just an annual routine eye exam. We are going to check the pressures, we are going to look at your nerves, and we are going to check all the other risk factors and put them all together to see how high of a risk you might have for developing it.
And how does a patient get tested for glaucoma?
Just come in for your routine eye exam.
Okay.
We test the pressures, we look at your nerves, and we basically give you an overall risk factor if you should come back for further testing or not.
And how do you treat it? If it is determined that you do have glaucoma, how do you treat it?
The most common treatment is actually just eye drops.
Okay.
And the very most recent ones are actually just once a day at nighttime, put a drop in, and that actually keeps your pressures low throughout the whole 24-hour cycle.
And what happens if the condition goes untreated?
Well, if it goes untreated, like I said, you're going to continue to lose your peripheral vision and may end up with essentially tunnel vision or lose your vision altogether, depending on how extensive it can develop.
And when you talk about loss of peripheral vision, that's a big deal, especially if you're driving.
Exactly. So North Carolina and most other states actually have a certain degree of peripheral field of view that you need to have to be legal to drive.
Ah, okay. Well, we have posted a lot more information on WBTV.com. You can look in the Web Extras section right there on the homepage. Dr. Ben Stager from the My Eye Doctor Network. We certainly appreciate you taking time tonight to talk about this very important condition.
Absolutely. Anytime.
Thank you. I want to get back to Delano now.
All right, time to